Right. Mariana, what determines the maximum amount of fat transfer to breast? When do you know you put too much or can't fit any more fat? Good question, Mariana. And it's really interesting. And I think probably people think the public think there's more of a science to this than there is, but there isn't a science to this. And the two aspects of fat transfer are donor sites, so where you can take it from, how much fat you've got on your body to take it from. Usually, people who are having fat transfer to the breast are slim, usually, because it's usually for something like a breast augmentation. So, someone wants a breast augmentation, they don't want implants. Perfectly reasonable, don't want implants, no problem at all. Can use fat transfer, but they're usually slim people. And so the donor sites are often limited. So where you might say, oh, I've got loads of fat, but actually, I haven't got much fat. But you can take it from anywhere: abdomen, hips, thighs, outer thighs, things like that. So that's number one thing. And number two thing is the other thing that limits it is the recipient site, so the breast. Because what you're trying to do is you don't really want to inject the fat into the breast tissue itself. You have to inject it sort of underneath the skin, between the skin and the breast, and also beneath the breast, so between the breast and the muscle. So you have to sort of surround the breast with the fat, and you have to put the fat in tiny little aliquots because each little piece of fat has to be surrounded by vascularized fat. So you only put in tiny, tiny little aliquots at a time. And really good question: how do you know when you put too much? You don't. Quite frankly, you don't. The way you'll know you've done too much is if, a couple of months later you start getting hard lumps, the fat dies, or you get oil cysts, or you get infection, or you get problems. Then you put in too much because the fat has died. But when you're doing it, you don't. And so you could say if you've never had these problems, you haven't put in enough fat because you've never pushed those boundaries. And you know, my view is a tendency more to less flat fat. So I don't get fat necrosis or hard lumps. I don't say I not get it, but it's not common to get oil cysts, fat necrosis, and lumps and complications like that. But it's small volumes. If there'll be another surgeon next door who does big volumes, and you might say, "Oh, I want the big volume guy because I don't because when I do it, you often have to have it done again, and it's expensive. It's an expensive operation." And you might say, "Well, I want the big volume guy because I don't want to have to keep on coming back. I want big volumes." But then not that it's good or bad, but you're going to increase your risk of complications with fat necrosis, lumpiness, cysts, infections. Where is the point? There's nothing in theatre that tells us that's the maximum stop now. That's the problem. It's clinical experience, and there isn't anything that says you've put enough fat in now. So it's surgeon's experience what determines it. But I always tell people it's subtle, usually less than a cup size. Once you put some in, then you can put more in next time. And so it often has to be repeated.